Welcome. You're listening to Ask the Doulas, a podcast where we talk to experts from all over the country about topics related to pregnancy, birth, postpartum, and early parenting. Let's chat.
Hello. This is Kristin Revere with Ask the Doulas, and I am thrilled to chat with Dr. Desiree Cassell. Dr. Cassell is a doctor of physical therapy specializing in women's pelvic health. She's the host of the Balance Momtality podcast and owner and PT at the Balance Momtality Women's Health and Wellness, where she coaches women in person in her home state of New Mexico, as well as virtually all over the world. She is a foodie, lover of all things movement and nature, and a mom to 3 energetic and active kids, 13, 6, and 4. After her first pregnancy, Dr. Cassell suffered with her own pelvic floor dysfunction, and like many, she just accepted it as part of motherhood. Sadly, that meant no more jumping on trampolines and crossing her legs fiercely every time she sneezed or laughed so she wouldn't pee herself. After PT school, she got pregnant with her second and was determined to put her knowledge to the test and was able to completely resolve her issues even while she was pregnant, leading to her passion in educating, empowering, and supporting other women throughout their lifespan so that they didn't have to accept these common issues as part of life. Desiree uses a holistic, whole-body approach to helping women heal their bodies and stay balanced throughout all stages of life, starting at the core. Welcome, Desiree.
Thank you so much for having me. I am so thrilled to be here.
And our topic is an important one. So we are talking about pelvic floor physical therapy as a way to optimize both your birth experience and postpartum recovery.
Yeah, I am so thrilled to talk about this because this is, again, just something that I didn't know. I had already had a baby and didn't know that pelvic floor PT was a thing. So I'm just so passionate about spreading the word and just making sure that people are aware that there is support out there and that you don't need to pee your pants. We don't have to accept this common thing, right? And I think that's the thing, is it's common, not normal. So many things we just accept as normal and they're just not. So I'm thrilled to talk on all the ways that pelvic floor PT can help.
Yes, it's such an important topic. I feel like, again, there is more knowledge when is in that postnatal phase, especially of the leaking and the fact that you don't need to suffer. And there is support. And oftentimes now I'm seeing OBs and midwives talk about pelvic floor physical therapy as an option in that 6-week visit. So before, when I was in my early days as a birth and postpartum doula, my clients weren't learning about that until I brought it up as an option. And now I feel like there's more awareness and education within the healthcare system. Would you agree?
Yes, I do think that it's kind of a trendy thing right now, which is good. I think that it's good to have it just be more in the know that pelvic floor PT, again, exists at least. And now it's just about knowing, like, it's more than Kegels. It's more than peeing your pants. There are so many other things that pelvic floor PT can prevent and treat. And just, again, I think even OBs and midwives and other women's health providers might know it exists, but there's still just such a misunderstanding of all the ways it can truly help. And I'm unfortunately seeing women, ideally I am seeing them like pre-pregnancy, during pregnancy, early postpartum, but I see women, 5, 10 years postpartum, 20 years postpartum with that common story of this started after my first baby, or maybe it started after their third baby, or I mentioned this to my provider and they told me to go do Kegels, or I got told this was normal. And it's just so disheartening because it's not true and we can do better, but it starts with knowing better, right? We got to know better before we can do better. So again, thanks for having me here so we can help our listeners know better so they can do better.
Yes. That's what it's all about, knowing your options, because if you don't know them, then you don't have any, and then you just end up suffering in silence. And I also feel like, as you said, pelvic floor PT is a trendy topic. So friends are finally talking about it amongst themselves, where it was more of a hidden thing. I tend to work with a lot of athletes. And so in those circles with runners and swimmers, they talk about pelvic floor physical therapy and physical therapy in general, and the ways to return to their passion and their sport without leaking or other physical discomforts. But now it is becoming more mainstream and not just discussed within my circle of clients who happen to be athletes.
Yeah, I'm so thankful for that because it's something I think everybody should know. Everybody does have a pelvic floor, males included.
Right.
But women are so underserved. And so I do have that passion of really just helping women understand their bodies. And this is such a taboo space. Our culture has made the pelvis and the vagina and anything in that area such a taboo topic where we are afraid to even talk about it with maybe even your mom or your sister or your friend, or you feel brave enough to bring it up to your provider only for them to blow you off and write you off. And it's just so unfortunate. And it's a cycle that needs to be stopped.
Yeah. And I love that your own personal experience and healing yourself led you to focus on this particular specialty, because within physical therapy, there are so many different ways that you can specialize and work with different populations. So I love that your own experience as a mom led to your passion in not only creating your local practice, but supporting more families with your podcasts and your virtual services.
Yeah, it's so funny because it really was so mind-blowing. Like, I did not expect to be like a vagina doctor. That was not
Right?
where I thought I would go. And I was really into sports ortho. I've always been athletic. I did sports through high school and lifted and played basketball and stuff through college, not at college level, but recreationally, right? Stayed active
Sure.
and had my own injuries and just felt pulled to, I've also had a burn injury and things where I was like, you know what? I just like the outpatient ortho world. And I was so surprised that the women's health pelvic floor thing kind of just fell in my lap at a clinic that I was really wanting to get into. And step back just a little bit, my third year of PT school, I was pregnant with my second, and I was still peeing myself from my 6-year-old 6 years ago. And
Yeah.
at that point, I had that gender health pelvic floor course in my program, and it was just a general pelvic floor health class. It didn't go deep, but it was enough to learn that no, it is not normal to pee yourself and not normal to have a lot of these different aches and pains that we accept during pregnancy. And I learned about pelvic organ prolapse, which again, had never heard that term before, and was like, wait, you mean our organs can just fall out of our body? Like, that
Yes.
is not okay. And at the time I was like, man, who would ever want to do this specialty? Like, I give them so much praise, but also like, not for me. Like, no thanks. Then I got pregnant with my second, and I thought, you know what? I'm going to actually put what I learned to the test because I'm
Yeah.
personally sick of peeing myself. Like, that's not okay. And I'm sure it'll get worse through this pregnancy. And I was already starting to have some heaviness, which I later learned was pelvic organ prolapse and some of these other aches and pains that we accept. And I got it all to go away. Like, my leaking stopped, a lot of my pain stopped, my prolapse heaviness symptoms went away. And it was while I was pregnant. And that was just that light bulb moment for me of like, oh my gosh, this actually really is a game changer. And how did I not know
Yeah.
about this sooner? And it's just, again, touching back on it being so accepted. Because even my mom, is like, oh, yeah, that's why I don't get on trampolines anymore. Like, that's just what happens when you have kids. And we just are told to accept it and that it's normal. And once I learned otherwise, I was like on a mission. But even then, I wasn't sold that I was going to do that. But being in that ortho clinic that wanted a women's health therapist, and they said you can do part women's health, part ortho, and we'll pay for your training to go take those courses. I was like, okay, sure. I love women. I love moms. Let's just
Yeah.
give it a shot. After seeing those women, and again, hearing those stories of being written off, hearing the stories of not having intercourse for 5+ years because of pain, or not being able to go out on road trips because they have to pee all the time, and just
Yeah.
getting these women on a different level of quality of life that was just so rewarding, and sometimes, many times, being the first person to really hear them and hear their story and validate them. And it is just such a passion of mine now. And again, totally unexpected, but now I could talk about it all day long, obviously.
I can tell. It's beautiful. So, Dr. Cassell, when should women start making that first appointment for pelvic floor physical therapy? What is a good time to see an expert like yourself?
Yeah, again, I am a huge advocate of being proactive and preventative with our health and wellness. And so I do think every person should see a pelvic floor PT if you have never seen one. But again, a lot of these other symptoms that I mentioned that are very local and obvious, things like leaking. And again, it is never normal. So even if you're leaking on that third sneeze, it's still not normal. If you're leaking because you're pregnant, still not normal. You had a baby, still not normal. So any amount, anytime, if you did not try to release it and it's coming out, whether it's urine, feces, gas, that is not normal. So if you cannot hold that and you are losing control, but also if you're having inability initiating your urine, or you're constipated. Constipation is another big pelvic floor symptom that so many Americans struggle with, that goes hand in hand with the gut. Again, I do look at that whole body, whole system approach. So we're looking at gut health, and the pelvic floor is so intimately connected with everything in that space because of the proximity with bladder and the uterus and the rectum, and therefore the GI tract. And so we can see a lot of constipation, bloating, pain is another big obvious thing. You know, if you've got pelvic pain, and this can look like pubic bone pain, tailbone pain, pain with sitting, pain during intercourse, pain after intercourse. Heaviness. Again, heaviness is not normal. And obviously, right, like there's some level of normal heaviness when you're pregnant and it's your second, third, fourth pregnancy. Sometimes that heaviness comes on a little sooner. But even then, we need to make sure it's not true pelvic organ prolapse, because once those pelvic organs, whether it's bladder, the uterus, the rectum, if they're starting to lose their structural support with the ligaments, not the muscles, so the ligaments and tendons are there holding those organs up. And once that starts to stretch and those organs are starting to drop, we need to get on that as soon as possible, because age and gravity are not on our side, right? And so things will only get worse. And so we need to make sure we're preventing any extra heaviness and pressure. And that could be from constipation. That could be from baby. That could be from pelvic organ prolapse. That could even be a sensation you're feeling of heaviness from your pelvic muscles cramping up and spasming because they're trying so hard to support your body. So again, heaviness, really want to look into that. But then we also want to look outside of the pelvis, where things like hip pain, hip dysfunction, hip instability, pelvic floor muscle that we have is a hip stabilizer as well. And so we can see a lot of hip issues, and knowing too that that pelvic floor does connect that whole pelvic outlet. So it does connect up to the tailbone, and therefore that sacrum bone. We see a lot of spinal issues. So low back pain, SI joint pain, even mid and upper back pain and neck pain. TMJ is a huge connection, both physically and just nervous system wise, from the tone and clenching, but there's a direct fascial link there. So if you've got TMJ, I can pretty much guarantee you've got pelvic floor tightness as well. And so I think so many people just think of pelvic floor issues and think it's weak. We need to strengthen it. When really so many times I find that yes, even if weakness is an issue, things are actually usually too tight because it doesn't know how to support the body. So therefore it just cramps up and creates like a spasm in that muscle. And you can't really go into strengthening right away, or you're going to make that situation worse. So again, it's really helpful to get that internal assessment to know, where is your pelvic floor? Are you going to cause more issues by starting to do things like Kegels and strengthening? And instead, maybe we need focus on some other things to help that whole system work together. But before I go off on any of those tangents, I just want to again kind of touch on when you should see a pelvic floor PT, because aside from just those symptoms that I mentioned. Another common symptom is diastasis recti, which is that separation of your abdominals that happens with every single pregnant person. However, we can see excessive forces there, which then can cause extra thinning and therefore dysfunction, and maybe even possibility for hernias and things like that. And hernias are also another sign that you have pressure issues in the core and would benefit from seeing a pelvic floor PT. But obviously pregnancy is a huge thing. And I think the sooner the better. If you're pregnant, again, get in to see a pelvic floor PT before you have any issues, because then you can avoid things that we accept, like leaking, round ligament pain, SI joint and low back pain, urinary urgency and frequency, and just feeling like you have to pee all the time or you can barely make it to the bathroom. We can avoid a lot of that. So the sooner the better. And also, again, to prepare for birth, right? Because birth is a marathon, and that is that marathon of pregnancy you also need to train for. We need to make sure you have that flexibility in your pelvic floor muscles to open up and get out of the way so baby can come through, especially if you're looking at getting a vaginal delivery, especially if you're looking for at a VBAC, right? If we've had some scar lines from that cesarean, we need to make sure things are mobile and moving, and that scar and restriction isn't going to impede baby from coming through that birth canal safely. And optimizing your pushing strategies so we're not getting too much pressure and causing prolapse, and looking at how we can optimize our recovery and heal optimally postpartum so that you're again avoiding all of those issues and not just waiting for that 6-week check, because unfortunately that 6-week check does such a disservice to what should be happening as moms getting cared for and looked over. I think 6 weeks is way too long, but also it's way too soon to tell someone they're quote unquote cleared to just return to activity as normal. So again, postpartum, anyone that's had a baby, I think should see a pelvic floor PT. But if you are having obvious symptoms I mentioned before, then it's more of like a sign that your body's kind of trying to yell at you to get some help. So it's better to be a little more proactive, as I say.
Exactly. Rather than reactive, is just have a plan. And even if you need to get a referral, which not all pelvic floor physical therapy requires, depending on your insurance plan, you could get that referral done during pregnancy and not wait for that 6-week visit.
Hey, Alyssa here. I'm just popping in to tell you about our course called Becoming. Becoming a Mother is your guide to a confident pregnancy and birth, all in a convenient 6-week online program. From birth plans to sleep training and everything in between, you'll gain the confidence and skills you need for a smooth transition to motherhood. Live coaching calls with me and Kristin, tons of expert videos including chiropractic care, pelvic floor physical therapy, mental health experts, breastfeeding, and so much more. You'll also get a private Facebook community with other mothers going through this at the same time as you to offer support and encouragement when you need it most. If you'd like to learn more about the course, you can email us at info@goldcoastdoulas.com or check it out at thebecomingcourse.com. We would love to see you there. We also have a book called Supported, Your Guide to Birth and Baby, which makes a beautiful companion to this course. It's a great book for any expecting mother and is the perfect baby shower gift. You can find information on that book at supportedbook.com.
Yeah, because honestly, especially with the insurance world, which I'm not an insurance-based practice for many reasons, but there's such a benefit to having those as options, obviously. But one of the big downsides is a wait list. So if you already know that your due date's coming up and you've got even some waits are 2 to 3 months. So if you wait for that referral at 6-week check, you've already missed that window that is so crucial for healing. And that from a pelvic floor PT standpoint and a recovery standpoint, those first 10 to 12 weeks are crucial. That is where we can either put too much pressure in the system and cause a lot of issues because the tissues are so vulnerable and are trying to heal. And if you are putting too much pressure through the body because you are slouched over and feeding and carrying and holding 90% of your day and you're not breathing correctly as you're moving throughout the day, that can cause the leaking and cause the prolapse and cause the pain. And when really we can optimize reducing that pressure, improving your movement strategies, and helping your body slowly get back into strength training and impact training so that your tissues are actually healing and remodeling at the length and the direction that they should, and therefore providing the support you need and preventing issues. So it's just such a bummer when I see the women that have waited until they got the clearance, they went straight back into running or something, and they come back for 6 months postpartum, and now they've got all these issues. And I'm like, oh man, I wish I would have seen you sooner, because we would have made a much bigger impact.
Yeah. And you mentioned again in the pregnancy preparation, it can help with pushing. I mean, you can see a pelvic floor physical therapist in pregnancy, and there are a lot of things externally that can be done to reduce discomfort, have a better outcome. You mentioned VBACs as an example. So I do refer a lot of my VBAC clients to pelvic floor physical therapy for the reasons you mentioned.
And that's so good, because it's, again, something that to me seems so obvious, right? A C-section is intense. Birth is intense. Even if you had your most quote unquote optimal birthing experience, you and your body are still probably kind of traumatized and thinking, what the heck did we just go through? But especially if you ended up with like an emergency C-section situation, or even opted for that C-section delivery, which again, no shame either way, but your body is going to be going through a lot. A C-section is not a gentle procedure by any means. And many times they are just given the pain meds, given the stool softeners, given a handout, and sent on their way. And it's just so sad, because with C-section especially, you have physical scar lines that are going to be changing how your muscles work, how your body is going to show up for you. And if you don't rehab that and get that scar moving and return that core strength and stability, you cause so many issues down the line. And it might not be 6 weeks, 6 months. It might be 6 years, 10 years down the line that we see the issues from that. But C-section, it's just such a bummer. I do think it should be standard of care to see a pelvic floor PT from any delivery, but it's an obvious one for me because it's a procedure, and yet abdominal procedures, again, we're not really sent that pelvic, or not even pelvic, but just physical therapy. A physical therapy referral after any abdominal procedure, I think, should be standard of care, because it makes so much more sense for them on a joint. You get an ACL repair or even a laparoscopic ankle surgery, and they're sending you to PT 2 to 3 times a week for 6 to 8 weeks. But they cut into your abdomen, or you birth a child, and there's nothing. And it's just so mind-boggling to me, and so sad, honestly. And I'm just, a huge advocate to change that.
I agree. And as you mentioned with cesarean recovery, I feel like there's a misconception that the only people who need pelvic floor physical therapy are those that, had a vaginal birth and maybe some trauma in labor or again, leakage. But it is both. The surgical birth as well as vaginal would be a good candidate for pelvic floor physical therapy.
Oh, totally. Because obviously, yes, you might not have vaginally delivered your baby, but say that was an emergency C-section and you did push for a couple hours, maybe you've been laboring for a couple days, your pelvic floor still took quite the beating during that delivery. But even if you had a planned C-section and you had 0 labor, your pelvic floor still carried that baby for you for 9 months. And so
that's the thing.
Like it still took a beating, and it's all connected, right? It's a system. It's not just your pelvic floor, and it's not just your abs, and it's putting that whole core system back together and making sure it is functioning optimally as it should. Or are you engaging your core incorrectly and increasing pressure every time you engage your core? Is your pelvic floor even turning on? Because it is part of your core, and if it's not turning on when it should, then you are going to have issues. And so it is something, I get asked a lot, would that be beneficial for me? I had a C-section. And I'm like, yes, especially because you had a C-section, because I'm sure we're looking at back pain a lot of the times, scar pain, scar sensitivity, pain with intercourse. There's a lot that pelvic floor PT can do. And even looking up beyond the pelvis at things like mommy wrist, or having that nerve pain coming down into your arm, and upper back pain, neck pain from all of the slouching and carrying and feeding and holding that you're now doing that your body hasn't been used to. So it's just optimizing our movements and making sure that every time you are bending over and picking up that baby, you're not increasing pressure on the pelvic floor. And instead, you're making that actually more of a pelvic floor and core workout, as I like to teach my patients. I really don't go for traditional Kegels very often at all. It's more looking at how is that whole system working together? Are you engaging your brace every time you're bending over, pushing, pulling, carrying anything? Is your breath working with that core brace as it should? And then when we do that correctly, everything is a core workout, and therefore everything is a pelvic floor workout. And then you're also reducing risk of injury. So it's just, again, I could talk about all, but it's just such a benefit, and yet such taken advantage of service, I think.
I agree. Well, thank you for sharing all of your wisdom and passion with our listeners. What are your top tips for finding the perfect pelvic floor physical therapist?
Good question. I think that finding someone that is going to look at the whole system, because I've had some great physical therapists that are pelvic floor physical therapists in the area that I've even just been kind of disappointed to hear that they're not looking beyond the pelvis. So yes, we need to make sure that that pelvic floor is engaging and functioning well. And obviously you should be getting an internal vaginal assessment, which is where I do offer virtual coaching, and it is so great. I've seen it change lives. There's such a benefit for it. But I do think that there's amazing benefit in also getting that internal in-person vaginal assessment. And you can get that done during pregnancy. Some therapists don't like to do that during pregnancy. We don't do it during the first trimester, but I am a therapist that is a big advocate for getting that internal assessment during pregnancy. So you can see and know what your pelvic floor is functioning like and positioning like going into delivery. But again, someone that looks beyond that pelvic floor, looking at that whole system, looking at your feet, how are your feet transferring forces up to your pelvis? How is your posture above impacting your pelvic floor function? So looking at that whole body piece. And I would say someone that is spending a whole hour at least one-on-one with you. If you are being pushed off to a tech, if you aren't getting that one-on-one, pelvic floor is very complex, and a 30-minute session does not cut it. So we need to have some time with our patients and with our providers to really understand that big picture. And again, looking at it holistically would probably be my two big tips.
Advice, Dr. Cassell. Any final words of wisdom for our listeners?
I think just learn your body, connect with your body. And if you are having any of those symptoms I mentioned, get some support. It's an awkward topic, I know, but the more we can learn our body and understand our body and how it's supposed to function, we can understand better when it looks like it's not doing its job and when we might need some support. So there are so many great resources out there to start with, and there's a lot on, it can almost be overwhelming. And so if you are confused as to what information to take in, that's where I would get some one-on-one support from a pelvic floor PT. But there are, again, some great free resources. My podcast is one of them, and your podcast that I'm on now is one of them. So just educate yourself, empower yourself, know your body, and then therefore you can advocate better for yourself and help spread the word, because this is something that while it is trendy, there is still a big population subset that does not know that pelvic floor PT is a thing. And I think we all need to know.
We do. Excellent advice. So how can our listeners connect with you?
Yeah, so I do have my own podcast, again, the Balanced Momtality. Pelvic Floor Core and More is my podcast over there, where another great free resource to just tap in and start listening and learning bits and pieces there. But if you do want to know more, you can contact me on Instagram and Facebook at the Balanced Momtality. I did have a hacking issue this morning, unfortunately.
Oh, no.
So I may need to be redoing my Instagram account. I will be so sad if I have to start all over. But for now, it is the Balanced Momtality, and that is my Instagram page and Facebook link. And then, I have my website, www.thebalancedmomtality.com, where I do have more information about my services. Again, I offer virtual coaching and in person if you're in the New Mexico area.
Oh, love it. Well, it was a pleasure to chat with you, and I hope to have you on again in the future.
I'd be so honored. Thank you so much.
Thanks for listening to Ask the Doulas. For more information about Gold Coast Doulas, visit us on our website, goldcoastdoulas.com. We're also on Instagram, Facebook, and YouTube. If you like this podcast, please subscribe and give us a 5-star review. Thank you. Remember, these moments are golden.